Welcome back. I'd like for you to sit back and just take some big breaths. Now, if you've been relaxing for the week, I hope that you've been able to pay attention and remember how good it feels to be relaxed and to develop a sense of what that's like for you to be really relaxed, what your body feels like. Because relaxation is as much of a memory as it is an event. So try to remember. And if you haven't to this point, well, just take some breaths and relax the best you can. And if you have, you can remember, it's just a faster way of relaxing. It is a main line to your brain that tells your brain what you want it to do. So just sit back, take some breaths, big breaths, and just let it out. Because today we're going to talk about stress and the effects of stress. You know, stress is anything that requires your system, your mind, your body to make a change. What we call stress is really whatever we interpret. Stress is something that subjective. It is. It depends upon how we interpret it. You know, certainly for a person who's afraid of dogs, let's say, would not find it fun to go over to these box of dogs you find at Walmart. You know, somebody's trying to give them away, and you look at all those puppies and you go, oh, how cute they are. If you were afraid of dogs, you couldn't do that. It's interpretation. Are those dogs scary? Are they? Well, they are to some people, but that's the interpretation you see. They're not dangerous, but it's how you interpret them. What is stressful depends upon your thinking. Remember last week, we talked about if A is an event, if B is your thoughts, and C happens to be stress, then it's A, B, that makes C. It's not A. It's not the event. It's what you make out of it. Our body is designed to handle physical stress. You know, I bet you that probably 2 generations back in your family, maybe as far as 3, it's only 2 in my family, were on the farm. We're out in the field. They certainly weren't living in town, and they lived off the land. Well, when you lived off the land, you know, and then if you're going to be more connected to the physical dangers. And if you have to go hunt for your meal, then you're going to be more connected with physical dangers. And our body is better suited to handle that kind of stress and those kinds of signals of stress than it is psychological stress. Now, for instance, if you were out hunting and you see a rattlesnake, your body is going to go into a stress response. And that stress response generally is something like this. Your adrenaline starts getting pumped into your system so that your body tightens up. Your eyes squint so that you can see and you can focus more on what it is that you're afraid of. Your body tightens so that you are ready to fight or run. Your jaws tighten so that you can bite. Your breathing becomes real shallow. And the reason for that is that the shallow breaths is kind of like a pump that pumps oxygen into our bloodstream, gets it in there faster. You know, when you're trying to build a fire, You don't blow long breaths in there to blow it out. What do? You make small little bursts. And that builds the fire up because it's got more oxygen in it. So you're going to breathe shallow and you're going to breathe through your chest. Now, and that's your stress response. Now it's pretty clear you got a rattlesnake here. And it's pretty clear you're if you're a human being, you are in trouble. It's also just as clear when the rattlesnake is gone, when you have moved further away from it, when you've killed it, or it's moved off. When the stress is gone, when the event is gone that's stressful, it's clear. You know, what we live with today is not always so clear. It's not always so clear when the concern is no longer there. You know, we hear about it on the news all the time. Today we hear about terrorists. We don't know when, are they here or are they not? So our body is not set up to do these psychological things because it's not clear when it's over. It's not clear sometimes when it's even started. That's why when you have certain kinds of stresses at home, certain questions at home, you want to get it off your plate. Certainly. And I'm encouraging you want to find the truth. That's why I said if you're worried about addiction, ask your doctor. If you think that your family, or particularly your spouse, is angry with you, well, ask them. Get it off your plate. What happens when we get under stress is that our body then begins to adapt to that stress. And what that adrenaline that first gets pumped in, that makes our muscles tighter and gives us lots of energy to run and to fight, that the adaptation phase settles all of that. Now, the stress hormones, the adrenaline, still is going, but our body adjusts to that so that after you've been under stress for a while, it doesn't feel quite as bad as it did before. We make an adjustment, but the negative effects of that stress continues to go on. Then you hit, after a long-term stress, you hit an exhaustion stage. Now the exhaustion stage is when, the roof falls in, that your adaptation no longer can work, and the negative effects of long-term stress begins to occur. Now, what are some of those negative effects? Well, one of them is that your digestion stops. The blood in your stomach under stress moves out to your deeper muscles. Why? Well, so you can run, so you can fight, so you can defend yourself. Again, a physical problem, not psychological. Also, the feedback to those muscles is not as good, and so those muscles don't get back to a resting state. So you're faced with muscle cramps, muscle tightness, muscle spasms. The sugar in your liver is dumped into your bloodstream. And again, an army needs food. So if you're going to have to fight and run, you've got to have sugar to feed this army so you have energy to move. Now, what happens if you're a diabetic? What happens if you're hypoglycemic or hypoglycemic? What happens then is that your blood sugar goes up. Another thing is that your immune system stops. Well, it doesn't really stop, but the production of your killer cells, which is like the leukocytes, the lymphocytes, the megacytes, all in the lymphocytes, all begin to decrease in production. The body just doesn't produce them. So that when a job is needed, when your immune system is called to action, there's just not the number of agents there to help. It's like if you've ever been on shift work and you go to work and half the shift has been let go, you're in trouble because there's not enough people there to do the job. And when your immune system goes down, that's exactly what happens. And stress can drop it. In fact, in my work as a general psychologist for years, and where I worked with a lot of depressed people or those who've lost loved ones, after they've lost someone very close to them, I always had them go have a check of their immune system because that's generally lower. And particularly those who had lost a husband, a wife, because the chances are greater in a year's time that you can develop cancer when you're under that kind of stress. When the body goes into exhaustion stage of stress, the hormone begin to change because some of those hormones, such as the adrenaline, are short-term. It's kind of like a quarter horse. They can only go just so far, and then they lose their energy. And other things need to come in. So other hormones begin in this exhaustion stage to be produced. But your hypothalamus can continue to produce adrenaline. Some people do. So when they're in stress, they've got adrenaline continuing to be produced and they lose weight. And yet some of us, when we're under stress, gain weight because instead of the adrenaline being dumped, there is a steroid that gets dumped. Some of us, when we're under stress, our colon slows down. And when it slows down, we find ourselves getting constipated when we're under stress. Others, the stress excites the colon, and the rhythm of the colon increases, and so what you get is diarrhea. Food goes through there faster, and you get diarrhea. Long-term stress, the body begins to put out a chemical called cortisol. Now, cortisol has many good qualities, but when it continues to be dumped into the system over a long period of time, it has been found to increase depression, decrease libido, and make menstrual cramps much more severe, muscle spasms, migraine headaches, Raynaud's disease, now that is cold hands, cold feet, memory concentration problems, and it decreases bone density. In other words, if you have difficulties with osteoporosis, this is just going to increase it. Now, there's no test that conclusively is going to point out whether you are a high risk or a low risk of getting ill. But there is an adjustment scale by Holmes and Ray. I want you to look at it. Now, and this is a test that you're going to be taking when you have a chance. You don't have to do it right now. I want you to just listen. But just notice what's on this scale. And to the right of it is numbers. And those numbers are the value set for that particular event. And of course, the death of a spouse would be 100. And as you look down, you have marriage. Well, wouldn't that marriage be something that you would think would be wonderful? Yeah, but it's a change, see? And changes create stress. And a lot of that, again, depends on how you're going to interpret the situation. Certainly being fired at work would create stress. Everybody would know that. But what about retirement? Isn't that something we all work on? But there is a change. So any change. Pregnancy. Well, that all depends on how you interpret it. A change in financial state. Now, many of you probably have had a change in the financial state in the negative range, and that is stressful. But think about these people who have won thousands, millions of dollars in the lottery. If you look at the history of them, this was not a great shake for them. A lot of them get divorces, they wind up broke. It is stressful. Going on down the list there, you may see a change in responsibilities at work. Well, you see, that could be an advancement. It's not necessarily that you get demoted. The wife begins or stops work. Hey, that could be a good thing. And then with pain patients, that can be a negative thing. But it really depends on how you're going to interpret it. To have your wife working, for us men, that seems like we have failed. And yet, if it was reversed and they stayed home and we went to work and there's just one person still working, that makes sense. If it was reversed, would we mind going to work and letting the spouse stay home? No, we're doers. But the same things don't apply to us, see. The change in social activities, change in school, change in church activities, change in eating habits, vacation. Now, vacation, you see, is not, they call it R&R, but it's not necessarily rest and relaxation. There's a lot of stress, a lot of changes. Christmas is down here. Well, I want you to look at these and circle the ones that apply to you within the last year. Then you're going to add them up. And those with 150 or less, according to this, has a 30% chance of serious health issues within the next 2 years. If yours is 150 to 300, then you have a 50% chance of a serious illness coming up in the next 2 years. If it is over 300, you have an 80%. Now, this is not conclusive, and so don't freak here, but just use it as an indication that that stress does create illness. Stress is not a good thing for your body. In fact, there is nothing, no ill known to man that stress cannot accentuate. Now, the symptoms of stress, and you will see on the screen here, you're in stress if you if you have difficulty making decisions. If you feel like you would just like to get away from it all. If your chemical use or mood-altering drug use has increased, and that's not necessarily by doctor's order, then that's often a sign of stress. Difficulty making decisions. You feel your mind races. You're confused. I hear that often. Excessive worry, losing your temper, pulling back from your friends, feeling inadequate. More physical ills than just your pain condition. Now remember, the immune system and stress going down. Of course you're going to have them. Muscle cramps, gastrointestinal distress, and depression are all symptoms of stress. And like I've said all along, relaxation is one of the building blocks of pain management. Stress is going to increase your pain. And it is impossible to be relaxed and stressed at the same time. So work on your relaxation. And for those of you who realize that you have found many good reasons to avoid doing your relaxation more than once a day through this last week, you may want to practice your relaxation a little bit more. Carve out a little space for yourself, because isn't that just like us, that we defer to everybody else and we don't take care of ourselves, at least during this course. Take care of yourself, because you can enjoy life again. This is Dr. Hawkins, and I'll see you again.